Okay, so you may open your manila envelope, and I want you to pull out just one of the, it's fine if they're sitting out there, one of these small packets. The OPP packet is the one we're going to start with, OPP. Alright, and you'll see that on the screen, you have the same thing up on the screen as in front of you, so you can always look up there to reference it as well. And I'll go ahead and read aloud the very first page. So we're just going to go through this one page at a time, so please open to just the first page and we'll all stay there together for a moment. Alright, so we're going to explain a particular kind of program and the name of it, and then at the end you will be rating your feeling kind of or impression of this program. So you see at the bottom there's a scale from 0 to 100%. And you will indicate on that scale your favorability or not. So if you fully, totally reject this idea, you would be 0% or somewhere near there. If you are completely, absolutely in favor of this idea or this program, you would be 100%. Make sense? Mm-hmm. All right, here we go. So the overdose prevention program. Many of us have been touched by a life that was tragically lost to an opioid addiction. The worst part of the story is that each one of these lives could have been saved. Almost 50,000 people die annually from opioid overdoses. This is in the United States. Overdose prevention services change lives for the better through harm reduction strategies with an aim at full recovery. Services such as medical supervision with professional staff, counseling, and rehabilitation are provided. These services have been proven to reduce the spread of HIV, save lives, and transition people into the recovery paradigm. We don't have to stand for another needless death. Overdose prevention programs save lives. Go ahead and mark your favorability or lack of favorability, please.
How do you want
It
to mark
says
this?
write in answer.
You can, yes, thank you for pointing that out. You can mark it with an X and we can kind of guess what the number is, or you could actually write in an exact percentage, and that's fine too. So on that scale, if you're like 34%, you could write that, or 69%, you can write that.
Or you could just circle one.
Or you can just circle somewhere along the line and we can estimate. That's also fine. Or put an X, whatever. It allows for a little more variability. You don't feel like you're exactly a 20 or 40% or a 50 or 60 or something. Okay, you may now flip to the second page. And these will let you look at yourself. So you're going to have 3 images and information in the rest of this packet, okay? So take your time, you look at one, go ahead and rate favorability, unfavorability of it. Flip to the next page, favorability, unfavorability. There are 3. Go ahead. Can you guys see well enough to move one?
No, good.
Okay.
Let's read that.
Could you give an example of what these programs are?
That's a good question. I would say let's have you rate the favorability just with the information you have now, and then in just a moment we're going to open it up and all of that will probably be discussed. Okay? And you could go back to the first page if that helps you a little bit to have more information. And I hear you though, so in some ways what you guys are going with is just an impression of what you're seeing and reading, just kind of a first impression of it. Not much more to say than that.
So in this,
And the last page.
Does she have a funny one?
No, they all have like an overall.
Oh, I forgot about that. Okay.
Oh.
Yeah, the last page is just about the name of the program alone. I feel like we should wait and do that. I'm going to wait on that. I didn't do that last time, did I? I forgot that that was back there, kind of.
So we were talking about the name just here.
Just the name alone, your impression of it. Yep, we're going to go for it and we're going to keep it the same as we did last time. So yeah, it's just an impression of the name alone on that last page.
so this one that says 70% of addicts started with a
are we talking opioid addicts or?
Just opioid addicts in
Okay.
this case, so
Okay.
70%, and this is a
Okay.
statistic from a recent, important research study,
Okay,
that 70% of current opioid addicts
Okay, got
started
it.
from a prescription
Got
pill.
it.
Yeah, and you're not the only one that asked that question.
yeah. Okay.
Now, we did discuss that the study didn't absolutely lay out whether that prescription was to that person or in their home, a family member, a friend, and then they got the pill. So
Yeah.
that part we don't know, but they were, at some point, those pills were prescribed by a doctor. Did you get through to the back? All right, so I think we're about ready to open up for discussion. You guys may talk about this in whatever way you'd like, or you may have a question or two, and usually I can answer those. But yes, go ahead.
Some of the strategies are like needle exchange, harm reduction, kind of, it's just, the goal is just to reduce the harm to the person and the community and their family by whatever strategy works. In a way.
Yeah, I think,
In an overall sense, that's what harm reduction.
yeah, I think he's got
So like
it.
needle exchange does that, putting condoms, having people go to other services, making sure they're hooked up with WIC, stuff like that kind of stuff.
Comments, questions?
So harm reduction is the first step, and then you aim for full recovery, am I understanding that?
That's kind of what OPPs are talking about, yeah, that the underlying goal would be full recovery for every addict, but that's, with harm reduction, there's an assumption that may not happen for every addict, so therefore, what can we do to reduce harm as far as disease and death along the way?
Such as medically assisted treatment, right? I mean,
Yes, do you want to
such-
explain what that is? People may not know.
It's a drug that has other benefit, that it's just a substitute drug that can be monitored differently, by medical staff, that will reduce withdrawal, that, has other benefits. There's 3 or 4 of them that are used, but yeah.
And so in this particular program, we don't mention MAT or medically assisted treatment. That's not part of this particular program being proposed, but we've heard about that happening in different communities, and sometimes as a part of an OPP and sometimes not. So that would involve like a doctor is prescribing an alternative to heroin or more addictive opioids. It's usually, to put a little bit of scientific parlance out there, it's a combination agonist-antagonist. So it's like a cousin, usually synthetic, but not always, of heroin or any kind of opioid. That's the agonist side, but it also has an antagonist that's blocking receptors too. So it keeps people from having intense cravings quite as much, and it makes it much more easy to decrease their use over time, because they're getting the little bit of the high to kind of keep them from going into terrible withdrawals, but they're still getting this antagonist at the same time. Suboxone is one you might have heard of. There are others. But that is medication-assisted treatment, and that wouldn't be provided by an OPP necessarily, not in the way we have it here. It could become part of it. It depends on the program and what they decide to do. This is a little bit different idea. Okay,
So
sorry,
then-
there were more.
So then what does medical supervision mean then, if it's not
Good
what he's
question.
talking about, like Suboxone or something?
That means that someone who is trained in a life-saving procedure, usually something simple like administering Narcan, so this person would not be allowed to go into cardiac arrest or have into a coma. They would be supervised at a distance or enough that they could then be saved from an overdose.
Oh, okay, got it.
And as part of the prevention program, Narcan should be available to all non-medical people, anybody who's in the community who might have friends or families or acquaintances or even not And I don't know if that happens here. It happens in Massachusetts, where I originally come from.
I read a self-study recently by our, and I don't want to give too much of the background for you guys to let you just talk about your impressions and feelings. But we have the Southwest Center for Health Initiative, I think I have those letters wrong, but they did a major self-study of southern New Mexico and how much Narcan's available, is MAT available or not, and they found it quite lacking. So there is some access, but it's something I guess our area is looking into, that they
But
felt that was a
I
major.
think legally, anybody can get it from a pharmacist,
Yeah.
like you were
Yes.
saying.
Yes, if they have it.
Yeah, if it's available.
If it's available.
So in this program, is there training for family members of the people that are being in the program? And do they have access to the Narcan? Because it's very expensive. So if you don't have insurance and it's not covered, is there training for family members around? And do they have access to getting the Narcan in their home for emergent treatment?
Not necessarily, and not the way this is proposed. This would be for addicts only coming in, using their substance, and being saved if they were to overdose. I believe the programs do give the addicts access to Narcan to take with them, I believe.
So this specific program here is based on addicts who are ready to be clean. This has
No, not necessarily. No.
Because I guess what I feel from this is this is like a court supervision. You're told to go here on this
Good
supervision
question.
thing.
No, this would be an open door policy type of building, not even clinic necessarily. Some are run by more medical side of clinics, like an off-site clinic, like HMS could have one of these somewhere, or it could be a nonprofit. Depends on, ex-addicts sometimes run them. We don't have any in the United States at this time, but there are a number of other countries that do and have for about 20 or 30 years. There's about 142 sites around the world. But no, this would just be an open door policy for addicts to come in, not really signing up or necessarily having to enroll in a program. It could be a day-to-day type of thing.
So Jennifer,
Yeah.
as far as drug intervention, which was what was kind of advertised, we're strictly talking about opioids?
Yes, today we are talking about just
And
opioids.
is that because there are no other issues, or is it the biggest issue in the world, or?
No, a good question, Michael. It's really just because that's my particular research focus right now.
Okay.
Yeah,
Okay.
and so we're kind of narrowing on something that is considered a crisis, an epidemic, and maybe in part because of that recent self-study, and then lastly because the legislature this year put up a bill about potentially allowing one of these programs or many of them in New Mexico. And so that caught the interest of one of my students, and he approached me about, can we do a study? Would the public support this or not? If it does get through the legislature, how does the public feel about it? So that's why we're here. Yes. One second. Yes.
So is this kind of, so my experience with friends that are addicts, the opioids from, say, a prescription, if that's the only thing that they're doing, have a much different attitude towards using and wanting to get off of it than addicts that tend to use other drugs. So when I look at this as being a strictly opioid from prescriptions, you know, they're prescribed, they ended up on them, they can't get off of them. It tends to be a different mindset than those that are using opioids and other drugs. They, you know, programs that they do the needle exchanges, I've got friends that have done that, and it's more of a enabling once they're down that path very far. It seems like this is a good program when you can catch people early on in the addiction.
Interesting.
And once they're further down that road, it seems to be that programs like that are viewed more as I can keep going and I'm getting help doing it.
Yeah, and you're right that this would probably involve a needle exchange as well.
But that seems to be my take from friends that have gone down sort of some of these roads.
What do you guys think about that? Go ahead.
I think that it's very short-sighted of any of the helping or governmental agencies to focus on the opioid addiction as a separate problem. Because I agree absolutely with what you just said about people who, people, particularly seniors, people my age who are prescribed opioids for pain and then become addicted, have a much a much better impetus to get off them because they haven't been all their lives addicts. Now, I've lost 2 sons to addiction, alcoholics. However, all during the term of their lives, one was 50 when he died and the other one was 39, and all during the term of their lives, they were alcoholics, but they didn't just stop with alcohol. They did heroin, they did coke. And I'm pretty sure that my son who died in 2014 had just come out of the hospital for another detox, and I'm pretty sure that they had prescribed opioids for him. You know? So my view on these programs, and I've actually written to my congresspeople about it, is that there's a larger problem in this country with addiction than just the opioids. And yes, the opioids are causing tons of deaths, and that's why Narcan is a good thing to have in the community, because we can at least postpone some of these deaths until we can get a program that will bring these people who need help in.
Thank you, Diane. So I'm going to have Pete go ahead and talk for a moment, and then we're going to move to the next segment, but this conversation will just keep going. You'll see that it will connect all together. Go ahead.
I like that when you mentioned the program's kind of an open door thing, day to day, come in when you can or when you want to. That's important. I worked out on the street with DOH, Department of Health, working with addicts and stuff, and so it's important that they can come in at the point when they're ready to access programs or to access treatment or to access rehab. Because there's a lot of times when people will want to get into a recovery mode, but it's like all of us in our lives. It's like a roller coaster. Sometimes you're ready to do something and then you're not, and you're ready again and you're not. So it's really important that they can go in at whatever point they feel they're ready to do it. And just one other thought about needle exchange and whether that's an enabling program. My experience was people are going to do, they're going to do their drugs, whether there's programs or not. And it's important that we provide harm reduction strategies like needle exchange, because the reason New Mexico actually got needle exchange didn't have anything to do with ODing or HIV even. It was all about hepatitis. Actually, that's what got it through the govern, the legislature and having the governor sign off on it. It was so we could show that we could reduce hepatitis C in this state, which was outrageously high. So
and it is effective. We do have clear research that needle exchange is absolutely effective in bringing down both HIV and hepatitis. Okay, so that means we are ready for your next packet. This is the SCS packet. Please get the SCS packet out and put aside the OPP. Oops, leave it in front, that's fine. Just don't mix it up with someone else's. I guess the best case scenario is put them back in when you're done. Okay, that way nobody gets mixed with anybody else. But let's only have the SCS out right now, since they don't have names or anything. I guess we should have numbered them. Smart. Next. We will number the packets too. Okay, So this one is called Safe Consumption Site. Every community wants to feel safe. Safe consumption sites get drug use off the street because no child should be exposed to hazardous materials while playing in the park. The facility, run by medical professionals, actively stops the spread of HIV and hepatitis C in a community through harm reduction strategies. These strategies have been shown to bring more people into the addiction recovery process than ever before. Safe consumption sites target crimes of desperation at their root to bring a safer, cleaner community to you. Okay, go ahead and rate your favorability or unfavorability of this kind of program. Or you can write in an exact number if you like as well. And when you're ready, you may turn to, you will have again 3 images, 3 other pieces of information about the SCS, and you will also rate your favorability or unfavorability or impression of what you see and read. The last page, just the name alone, please rate your favorability or unfavorability of the name of the program.
And this is just how you feel like this would work, like a percentage of what you think that this would actually work. Is that what we're thinking?
I mean, I'm kind of leaving that part of the interpretation up to you. I'm just going to say, what is your impression? I'm going to leave it very wide open, okay?
Jennifer?
Yes, let me just check. Are we ready to have a little discussion again? Do you guys need a couple more minutes? Let's give it about 30 more seconds.
Well, in this package and the previous one, there was some statistics implied by words like proven, shown.
Good point.
What programs have you looked at that indicate this is proven and shown, and where are they?
Good, good. There are, like I said, about 142 that we know of operating safe consumption sites around the world. And there's quite a few in Canada, many in Europe. We think possibly in some other areas, but that's been easier to track that those are happening there. None in the United States so far, except for possibly one underground site that is an unknown location. And a number of these sites, particularly the one in Vancouver that's been operating for over 20 years, they started a research project at the beginning of it and followed that all of this time and follow most of the people that frequent and use that space and what's happened to them, etc., their outcomes, that kind of thing. So we have pretty good data from a number of different sites around the world.
So Jennifer, the 3 programs that we're looking at in this packet are some that you have selected specifically for us to preview, and they're kind of a set thing by these names, or you're proposing that these would be the names of a program and giving them the attributes of how they would be serving the community?
Yes, I think you're getting pretty meta there, which I'd rather you not get. Yes.
Well, I'm just trying to, from the perspective of participation, say, are these 3 set programs that you're looking to propose for Silver City to adopt?
Great way to put that. Okay, so yes, I wouldn't mind if we move into you thinking about having one of these programs in your community. If this passes through the legislature, how do you feel about that? What do you need to know? What do you like? What do you not like? Yeah.
So this program is just pretty much like a trap house, right? Like a,
Say more.
yeah. You just go to get high, like an opiate den, like back in the day when everybody went, got high together and just kind of hung out. That's pretty much, this is what that is.
You may consume your drugs on premises.
And they live there, they stay there,
Not-
they just
no.
go get high and leave.
Generally.
So it doesn't
It's a
really
mix.
matter.
It's a mix. There is always a medical person
Sure.
though, checking that they don't overdose.
And they're allowed to leave at a certain time after they're not so high, or like, I mean,
I
everybody's
believe it's
always-
pretty wide open.
Really?
Mhm.
Uh-huh, okay.
Yes.
I don't know about the opioid, the safe consumption sites, but I believe there are several in Boston injection sites for injecting drug users.
So there is something going on in Boston, but it is not sanctioned, it is not necessarily legal. If, I don't know what you might have heard,
Well,
but
it's in court, about whether it's legal or not.
it, maybe so,
Yeah.
maybe so. Yeah, so Boston has a program where there's needle exchange, there access to services, to recovery, to detox, and
Yep.
possibly something else happening there too, but that has not been legally sanctioned so far.
That's why you said there's none in the US then. But there may be some other programs like that in some other US cities. that
There are, we know of at least one underground.
Yeah.
So are we talking about the first one we just did and then this one are intertwined at some point? Like with the needle exchange and that kind of stuff, like it doesn't
How do they
feel.
seem, yeah, let me ask you, how do they seem different? I think that would be the best question to start with. So what was different about the first one versus this one for you guys?
This is all drugs, right? It's not just
Yeah,
opioids,
it's like a trap house.
It could be open to other drugs as well. Yeah,
Right.
generally you don't have the risk of overdosing in quite the same way with other drugs unless, like we're seeing with methamphetamine, is often mixed with fentanyl now.
Yeah.
And fentanyl is an extremely powerful synthetic opioid, and so that can cause people to overdose. But generally it would be opioids that we were looking out for the overdose risk. But yes,
I
other
don't
things
think
could
I
be
would want that in my neighborhood.
I don't think so either. All I see is, I'm sorry.
Yeah, okay, let's have this Amanda.
I'm sorry.
and go ahead.
Just thinking of like they're going there specifically to get high, and what if something goes wrong and they can't get in there, and then you have someone like I've never taken a drug other than like painkillers, so I don't have that
Opioids.
mindset. Yeah, which I don't even take those, but they would always make me
Like
scared or sick.
acetaminophen or
Yeah.
something, yeah. Gotcha.
So I don't have that mindset, but I've seen it, and I've seen it in friends and other people, and that just scares me, thinking like, if it was in my backyard and my two little girls are out playing and easy target, easily approached, or I don't know, it just scares me a little bit. Also growing up playing sports, I was always on the field, and my soccer coach was a cop, and he used to have to like, that picture of the little kid walking barefoot.
Yeah.
He used to have to comb the field for needles all the time because it was like a well-known place for people to go and get high. So then again, I would love for them to have a place for just to do that, but then I know it's going to happen either way. So I'm
The
torn.
other Amanda was gonna talk first.
Oh, it was just, when I have this vision of couches and, you know, just a whole, like, a den, you know? I don't, how is that helpful to put them in one space to get them high as a kite and let them leave into the world?
Jeffrey or Marilyn?
Well, I was just gonna kind of
Tyrell.
bounce
Sorry.
off of that.
Sorry, Tyrell.
They sound kind of like
I'd
like a bar for drugs. I mean, essentially bars are set up the same way. You know, you can go and get drunk and then leave at any point, however drunk you are, and they're not going to stop you. They're just going to let you leave. But the people that are going to the bar tend to be more your, your social drinkers. I think you'd end up with your social users, and there's still a lot of people that are doing it, you know, in their house, wherever they are, in the park, on the sidewalk, in their car while they're driving. So I think this type of program would appeal to a certain type of user, not necessarily to your bulk users. Because I know when I was out doing my stuff, it didn't matter where I was going to do it. I wasn't going to go out of my way to go somewhere to get drunk or do whatever, get high, whatever. I was going to do it wherever was convenient for me. Just,
Okay. Okay, Marilyn and then Jeffrey.
So the thing I'm struggling with this brief presentation is having my head wrapped around what else is happening in these programs. So the impression of some of the people is that they're just going there, they're gonna do their drugs, it's just a place to go, and not necessarily anything else is going on.
Okay, let's go back to the slide with the words on it and see if we can't pull out if there's anything else. And that's part of what matters today is we want to hear what needs to be there. If you were to support this, what needs to be there for you? Do you have ideas about that?
Well,
Marilyn?
harm reduction strategies is like a really big bucket. And it's not specific to the kinds of activities that are happening. And if I were sitting at the legislative trying to discern the difference between what I want to support, I want to know specifically what's in each of these programs. What is the list of the services that will be provided to the people when they're there? Because safe consumption could be a great thing. It could be a person who already is aware that they are at risk in the activity that they're doing. And so making the choice to go to a safe consumption site already is like, okay, I'm thinking about
Maybe
this
I'm putting
being
my toe in the
dangerous.
water.
Let me see
Toward
what this
recovery.
is about.
Mhm.
I'm not gonna die if I go there and do my thing, and I don't wanna die. So they're already making a statement about their consumption and their use by making the choice. Like he pointed out, he wouldn't probably have done that. So that's a different mindset around the drug use. So it's just another approach that speaks to a particular individual mindset and where they are on the spectrum.
Interesting, okay. Yeah, I think Jeffrey was next, and then Michael.
I mean, I think Amanda's absolutely correct. Location is critical because this is actually happening in your community as we speak.
Yes, people are getting high left and
And,
right all around us.
And the spin shelter has no requirements for sobriety. Okay, so
Can you explain the spin? People may not know what it is.
there's an organization called Supporting People in Need that's already in our community.
It's right
And
next
these-
to my office.
Right,
So you know whereof you speak.
I
right?
see them in the alumni gardens all the time.
But I agree with you. If I do not want that next to my house. I do know these individuals intimately, but then again, I think Marilyn hit it too. While they are there are referral services available. That person is observed, and a life of recovery is presented while they are there. But it is already happening. I mean, a community has to respond in some way. This is a bigger issue, and where it's not, these people will wander. I mean, they will go where they have to go. Addicts will go where they have to go, and so
Thank you,
it's
Jeffrey.
already happening. Yeah.
Michael, and then you can.
Well, 2 points. First, the word safe kind of implies safe for the community more than safe for the particular user or addict, I think.
It's true. This
And
program
what
is
you're
focusing more on that.
presenting here.
But it could apply to both, really,
Okay.
where like you can come here and not die,
Right.
and maybe the community can be prevented from having as much public exposure and display of drug use.
The other thing I wanted to ask, in the 142 odd sites around the world, how many of them are in countries that don't outlaw drugs versus those that do outlaw drugs?
I don't think I can answer that.
I
because-
know that in France,
Yeah.
which is
Yeah.
mostly the ones that I was reading about when
Yeah.
we were researching, it is illegal in France.
Okay. Illegal,
Illegal.
yes.
So it's not like if they were on the street doing it, they could be arrested. But inside of these facilities, they can't be arrested.
Yeah, my best guess was that really only the Netherlands, I believe, has fully
Yeah.
decriminalized all of the substances. And I don't think the other countries that have SCSs have. So it's that kind of idea that, that none of these drugs would be provided, of course, on the premises, but someone could bring something in, they take that risk upon themselves outside of the area, but not inside. Okay, hold on one second. Good stuff, guys, and I know we're gonna get to the third packet in a minute, but Kid had something. Let's get a quick comment from
Yeah,
Kid,
just quick.
and if possible, Tyrell.
I just wanted to respond to what Amanda said about your neighborhood environment, right? So we live outside of Silver City in the mountains, but we are below one of the biggest party sites traditionally in this whole,
Wow.
right, county. So, yeah, one night we woke up and somebody's firing in our house, because they go up there and they come down or they roll their cars. All sorts of stuff happens, and so it doesn't stay, I think Jack was talking about this too, it doesn't stay in its safe house. And so what is the community? This was one of the scariest nights of my life, and I'll never forget it. I have PTSD too, so it was really wonderful, and
Yeah.
and yet I do want them to have a safe place where they can go and not die. I think it's a great thing, but it is very, very problematic, isn't it? And how that I think that would have to be dealt with. Like, how does that fit in the community? Where do you have these places? What are the protocols? How does the community feel about it? And you don't want to ostracize people and say, well, you have to go over to the back of beyond, because no, they're just people in trouble.
It needs to be accessible.
Yeah, but we
Let me
don't wanna
pause
be-
and
yeah.
check our time. So what is it there? It's 10.
We should.
With this
get into the
segment, we
next
should.
pack.
Okay, can you guys remember what you were going to say though? Because you will get another chance. All right, last packet. Let's open the SIF and put your SCS away. So OPP is done, SCS is done. We're looking at the SIF packet now. Just please open to the front page only, and I will kind of somewhat quickly read it. Supervised injection facilities. In 2019, 49,860 people in the U.S. died of opioid-related deaths. Luckily, addiction science indicates that supervised injection facilities give people a non-stigmatizing environment in which they can begin recovery at their own pace. SIFs not only save lives, but effectively help stop the spread of HIV. The facility provides a hygienic area in which people may consume their own drugs with medical supervision. In one study, in the 500 square meter area around the SIF, this was Vancouver, by the way, overdose mortalities dropped by 35%. There have been 0 fatalities inside of an SIF worldwide in 30 years. Additionally, neighborhoods with an SIF see a 30% increase in the use of detoxification services, bringing more people than ever into recovery. Experts agree that supervised injection facilities are the best way to combat the opioid epidemic and the spread of HIV. Please mark your favorability or unfavorability of a program like this. And please know that every perspective is welcome and in fact needed. We need to know what the public thinks. Okay, when you're ready, you can turn to, again, you'll have 3 images and a little more information, and you're just kind of rating your impression of it, favorability to unfavorable impression. You can write in a number or put a little X or a circle.
It says they died in that facility, correct?
Which one are you on?
Sorry, 0 fatalities reported.
Right, so there has not been a single fatality in an SIF worldwide to date,
When they opened these programs.
which was about 30 years ago. Yeah, not a single death.
Is it, I'm sorry.
Let's get our favorability ratings done first so we don't influence each other too much, and then we'll talk about the answer.
Yeah, don't worry about it.
I want to go to party places.
talk to me after, Peter.
And then you had the last page.
I'll set you up.
Street from us.
Right.
Okay, bro.
Yeah.
Okay, let's open up the discussion again. I think that both Tyrell and Pete had something to say. And I really want to not forget, Kara, you've been very quiet, so maybe we'll start with you, because I'm supposed to keep track of who's been able to speak. So why don't you talk a little about your thinking and
Okay.
feeling?
Well, I guess living in a small town, I feel somewhat distant from these issues, like I don't have to see them. And I wonder about how much is out there, and do we have a need in this community? And so part of my question is, are you literally talking about bringing something like this to a town the size of Silver City, or is this really truly generic, and would this be something more on the scale of Albuquerque or, something like that?
It would be up to each community. So if, with the current legislation that was presented, if it passes, then anywhere in New Mexico, they would be allowed to operate an SIF. And so then it would probably come to community by community. Would the community want that or feel there was a need for that?
Okay, and then to follow up on that, then where my mind was wondering was, if you did put something like these programs in a town like this, does that draw people in with these problems? Because of how small it is. And this could be a really desirable, this is a desirable place to live.
Do you mean to say that people would come here just to go to an SIF?
Yeah, or any of these programs. Potentially, if there weren't very many in New Mexico and they were hearing about it. It's just a question, but
Okay.
it's a fear, right?
What is scary? What's scary about that?
Having drugs in our community.
Having
They're
more
here.
drugs?
They're here.
I'm sure they are.
Having
I'm sure
even
they
more
are.
drugs than what
Yeah.
you're aware of?
Right.
Could I say one quick word?
Okay, yes, and then go ahead.
I'm sorry, do you want to
No,
go, Terrell?
Well, I was just going to piggyback off of sort of what's been, I think Kip brought it up more. So the sites are used, people leave, and then how are they interacted with afterwards? So they leave, they get in a vehicle, and they get pulled over, and they get a DUI. How does that work out? Because they were doing what they were supposed to, they were using it as a safe injection site, whatever they were doing. But they made the bad choice after. Where is the balance with that? Because technically, if you leave a bar and you drive, the bar can be held responsible for your DUI because they overserved you. How would that work with someplace like this, or they go out and there's a death as a result, or whatever
That's a
happens?
really good question.
I would just suggest, what do you do now when you're at a bar and you're drunk? You call Uber, you have a friend ride you, you figure out some other kind of public transportation. Maybe there's a ride service that's an auxiliary.
Well, but I'm not meaning
service.
just with rides, not just with like transportation, but anything as a result that happens after you get high at one of these facilities and then you leave.
Yeah.
The afterwards, are they just held responsible? Is there any responsibility held to the people that are supervising, saying, well, maybe you shouldn't have let them leave quite yet because they were obviously a little too high? Where's your line with that? How does that work?
Good question. So I see Marilyn and then Diane.
I think you're getting at what I was speaking about, in that there is a lot of detail not here that I would expect to be a part of any one of these three options, or a combination of all three of them at one location. And there would be the list of services, there would be those questions addressed, because a community has risk. They have risk in having the people in the community, they have risk in providing something like this. So risk reduction is going to be a huge aspect, I would hope, or I would expect, if any one of these would come into a community. And yes, the drugs are there. So this is an addressing in hopefully a positive way, not only for the community, but for those people that need to take advantage of the service.
Yeah, and maybe I can ask Peter, because he seems to have a lot of experience with this
Population.
But I've bristled every time time somebody says that the safe injection facilities, supervised injection facilities and a safe place to get opioids is a place for people to get high, quote unquote.
Yeah.
I don't understand that that's the case.
I don't think it is.
I don't think it is, and medically, I definitely don't think it's the case.
Yeah.
And people are, you could probably tell me more, but, I mean, people who come to these sites are usually in withdrawal, they're desperate, and they're given
Yeah.
injection as, an alternative to detox, which may not be available to them.
Well, let me do clarify that. They would not be given an injection. They would not be provided with any, unless this gets set up next to or part of a methadone clinic or
Yes.
something like that, they would not be provided anything. Now, they would be provided detox. If they come in requesting, I need to detox, I don't have any drugs on me, I want to detox, then yes, the medical professionals have their kind of steps, set of steps to keep them, probably a small amount of a medically assisted kind of medication that would keep them from detoxing too badly, but they would not be able to access an opioid through the clinic unless they were in full detox.
And well, I mean, one thought I had about this and being in a neighborhood per se is one thing that we utilized when I was with public health was we did mobile clinics. We had mobile outreach clinics where they were in mobile, we had big vans
truck
and
or
stuff that
van,
we
yeah.
had converted into medical clinics. We could do full STD exams in there at one point. So we went to them because a lot of times people don't want to come to your program, or they certainly didn't want to come to a Department of Health office because we were a government agency, basically. But just my personal experience on the street with folks was the worst and nastiest people we ever encountered were drunk, by far.
Yeah.
People on opioids are pretty chill usually, or in really bad physical shape where, they're not.
Well, that's why I asked if it was all drugs,
Yeah.
opioids, because, you get somebody on meth.
And maybe somebody on meth,
Opioids, right?
Yeah, I can even say people on alcohol are worse than the
I
meth
would agree with
addicts,
him in my experience.
in my experience. People on meth can be really tweaky and stuff,
Sure.
but people on alcohol are nasty and violent.
They really can be.
Absolutely.
Michael had his hand up, yeah.
Well, part of our motivation in all this is compassion for the users, but it also is our own safety as we're, addicts getting in
Like our public
cars.
health, yeah, our general together public health.
But addicts getting in automobiles and driving is a big factor in our fear, I think. And so is there a way of separating the keys to the car availability to the visitor to these centers?
Interesting.
Is there some system that might be put in place to drive them away? Somebody else taking the wheel as a requirement? I don't know how
So
that
yeah,
might
this
work.
is great, because any ideas you guys have, and I think we're almost to this last part where it's like if you were to support something, and I don't want to get there quite yet, I want to check in with Amanda real quick, but start thinking about like if you were to support something like this, what does it need to look like for you? Or not. Maybe it's just absolutely not. The consumption part of it I can't live with, and then tell us why. But if you were to be able to support something like this, what might it entail? Okay, yes.
Are these programs like an RTC program where they live there while this is happening, or
Not
is
that
it?
I've ever seen or heard.
Okay,
No,
so
see,
it's
we
at
have
by your
that kind of
discretion,
rehab,
then
right?
it's their choice to
Yeah.
come in and
Yeah.
get clean or not get clean. That's their
Exactly, because
choice.
we have rehab in the U.S. We have extensive
Yes.
and lots of programs
Right.
around. They're often very, very expensive, hard to access. Not in the neighborhoods where people that are truly addicted are there, they can't have it paid for. That's happening already, but this would be a different type of program. Okay, yes, final comments on the SIF in particular, and maybe how does it differ in your mind from the other two? Do you see differences?
I guess I don't understand it, but I do, but I don't, because if they go there and they're bringing their own drugs in, correct, and then they're being supervised while they what's to say they don't meet someone right outside who has some more, and then they just go to a park and do it, and then they overdose there.
You're right, that could definitely happen.
I know it could, but then I'm just, so that's why,
And
If
I
they-
think, I do remember there's a kind of a perimeter that the ones that are in operation tend to, like, no dealing within 100 yards, that type of thing.
if they're already doing something illegal, are they gonna listen to that?
I don't know. Yeah, I don't know. I mean, I think the addicts, what I've heard, again, there was one great study where they interviewed a lot of the addicts and were able to collect some of their thoughts and feelings about the site. And one of the things they said was, we need this place and we don't want anything to happen to it. And so they were willing to follow those rules that needed to be followed because there was something they found valuable about that situation. I don't know what more to say, but they found it valuable.
Do you know if, at the current injection facilities, if they have, education offered to them, like, while they're in there, or is it just a sign, or?
Many do, and I don't know about all. So I know that many have, like, down the hall, there's this service available,
If
and
you
a
want it?
counselor, or, not all, but many have, I've heard about one that even has like a space where people can kind of start to be creative or talk to each other about ideas, and certainly job opportunities, housing. A lot of times they have something like that nearby or even on the premises.
And
But
are
not
they
in every
24
case.
hours, open 24 hours?
24 hours. Yes.
And I want just to agree with Mary's comments about, I think that all these things have to fit together in a program. I don't think I could pick out one and say, oh, well, we could have that one, but not this one in Silver City. And one of the major things that's not in this study, and people should probably look at a lot of the information from the Drug Policy Alliance, is that if we don't take the profit motive out of opioids, the profit motive is legal. It's the big pharma,
Big pharma.
it's doctors. The rest of the drugs, heroin and fentanyl and all that is illegal, but I would be willing to bet that the most successful sites for all these programs that you've studied is probably in the Netherlands, where they've decriminalized everything. And they probably have a much higher success rate. So once you can get the profit motive out of it, you can also, I had kids who couldn't get into a rehab program. I paid $3,000 for 2 weeks for one of them once. There was no insurance available. There was no, and you had to, for alcoholism, you had to call every single day and drink until you needed to detox.
I have heard those stories. Yeah.
You
You
know
can't
what?
come in too
You
clean.
can't come in
But
too
you can't
clean.
come in too high.
No.
It's,
So, but if we can get the profit motive out of it, if we can somehow fund the programs so that more people can have access to them, there's always gonna be a bunch that aren't going to have the motivation. But,
so what I'm hearing, let me look at our time again. Are we to the point where we need to do our kind of final check-in? Okay. So what I'm hearing is there are some bigger issues that are a little more systemic and involve legality potentially of different drugs that you're thinking about, involve true rehab, whether it's inpatient or outpatient, and how that's funded and who has access to it. And so I don't disagree with you, but it's not for what we're doing today. You know, we're focusing on a little different element of this, but I don't want to ignore that those things are important too. And then there's the whole, like, how do we hold Big Pharma accountable, stuff like that. So I hear that. Okay, so this is what I want to do with our last little bit of time. I want you to now actually take your all three back out of your envelope. And on the front, and you can look at them again if you need to, but I want you to put a big black check mark on the one that you favor the most. After hearing what you've heard, thinking about what you're thinking about, which one, if you had to pick only one,
Can I ask a
do
quick
you favor the most?
clarification?
Yes.
I'm sorry.
Yes.
I really, when I was filling out, supervised injection facilities, I was thinking safe consumption sites,
Sure.
just in
I
my own
get you.
brain.
I get
So
you.
then when that came up, I was like, oh, I
Yeah.
thought that's what we were just talking about.
You know, it's not an exact science what we're doing, so it's okay.
Right.
You know, it's okay. You just go with what your first impressions are. It's just fine. We'll look at those later. Really, the conversation's probably what's most valuable to us, but we did want to give you a chance to put in some ratings as well, and we'll look at that. So at this point, right on that blue front page, yeah, just put a black check mark on the one that you lean the most favorably toward, okay? And once you've got that done, you can put those back in your envelope, but I guess we just now have a few minutes to kind of wrap up and maybe talk about what I really would like to hear is which one do you favor the most and why? Or if there are a couple of major things missing from all of these, what are they? We should know about that. We should hear from you about that.
Can I ask a question?
Yes.
Is the SPIN, do any of these programs work in conjunction with SPIN, or is SPIN specifically together?
Like if we were to say approve this here in
Yeah.
Brett County or something, could it be alongside SPIN, do you think?
Absolutely,
Interesting.
easily.
Could it be what? I missed that.
I was just wondering if any of these programs, if approved, if they could work alongside the SPIN or,
I would answer that by saying we'd be dropping a ball if we wouldn't be, because, I mean, there's certain skills we all bring, you know, and this field has to stick together. I mean, I'm on the phone half the day, you know, it's how it works.
So there's a lot of homelessness or home instability in this
Exactly.
population usually.
Did you check one?
even with teens, I think too. But I think about, like, you bring in something like this, which might
So
bring
how
in
about
more.
that?
1 second, I don't want to miss what she's saying. What was that?
I said I did not check one because it's, for me, it's not a choice.
Okay,
Okay?
okay.
That's what I just want her to know that. so
Gotcha,
she can
okay.
give it back to me.
Yes, and then,
Good answer.
I was just thinking there's, because we are in a small town, kind of going off of what you said, and we're maybe bringing in more, but there's not enough for our teens to do. And I worry that if there's even more drugs out there, they're gonna turn to that and the homelessness and everything else. So as a parent, my job is to educate my kids and hopefully maybe some of their kids as well, but.
do you guys want a horrifying statistic about our county?
Yeah.
Yeah,
Yes.
that's where I think people need to know really where we are. I mean,
So in the latest what is it?
YSD, yeah.
So the Youth Risk and Resilience Survey that's done nationally, but every few years in each county. 5% of our minors are reporting at least one use of heroin in the last month. 5%. And then up to 8 or 9% are reporting use of a prescription opioid that they got from somewhere. So it's here, it's happening.
Holger was telling me that Grant County is one of the worst in all of America
I would
for
look-
heroin and specific.
Not quite, but it's
No?
high. Yeah, I did look carefully at that to kind
Yeah.
of do a comparison. So the national average is probably more around 3 or 4%. So I mean, we're double that with prescription opioids. And our heroin use is a little bit higher than the national average, yeah.
Espanola used to be king of that.
Yeah, and it does change year to year. These things fluctuate a lot, but right now, that's where we're at. Okay, sorry, so go ahead and discuss a little like, what would need to be present in a program, one of these? If you had a favorite, you could say why, or if you didn't like any of them, you could say why, but what would maybe need to be present for you to be able to support it, yeah, or not?
I think Peter brought this up too, and this may sound self-serving, but I do believe in peers. I think that these people have had a lot of negative, authority experiences, and I mean, I'm not saying that the peer is it's just part of the team.
Mhm.
It's
Former addicts,
Yeah.
people who get their
the
experience.
former,
Mhm.
needs to be there,
Okay.
circulating.
I think, talking about what Amanda was saying, I keep piggybacking off of you, about spin being involved. I mean, that might make people feel better if there's a place that's already known, in a neighborhood that's already known, and then people wouldn't be terrified of having one of these places put in right next door to them, especially if they have children or something like that. So something like that could be really considered for the community, like where would you like this to be? Yes, I think that my favorite was the SIF, and I think this is amazing, great. But if you could put it in some place that's like the shelter where Yakov works, is, unfortunately you work right next to
Yeah.
it. But it is kind of it is kind of in a good location though, as far
It's a rough
as,
spot,
there's not a whole lot of residential stuff right around it. That's very thoughtful, I don't know how that worked, right? Right?
Yeah.
Well, the SIF was my choice mainly because I saw that the other two really were very similar in many ways, and that I would see the SIF at the top of the hierarchy, at the highest level, and all of those underlying programs would probably be up there anyhow. And I think if you look at all three of them, if you keep in mind nothing more than reduction of HIV, reduction of hepatitis, and those things, having those components that are in each of them, for a community, that's a huge health win right there. Let alone the fact that you are providing people with substance misuse difficulties, opportunities to start making the first step, and then all of those other supporting things. Like, I mean, I see transportation as part of this. I see alternative housing, short-term housing. I see all of that needing to be wrapped around and integrated with something like that. And that would be my expectation as a community member, is that we're just not gonna have a den where people go and do their drugs and take out and leave. It's going to be the first step in a support system to try to help get them healthy and on the road to recovery. And then we as a community need to know and make sure that those next steps beyond that first step are available, or at least we can get them there, even if it doesn't exist here.
Maybe that's
Probably
where you're going,
easier
but
for the community if that were the case.
may I ask for a dissenting voice? Is there someone who's kind of like, I don't think so, and to tell us why? Amanda?
I think the last two are the same. I feel like there's no, I've had a lot of addicts in my life. I have teenagers that are adult children, and I've seen many deaths through the teenage population, and it's awful. It's worse than when in the 90s. In the 90s was bad, but it wasn't that bad. It's
off the
really,
charts.
really bad what's going on with these kids. It makes me so sad. So things we don't have anymore for like the adults now. We had pot and we had pills, a little bit of pills, we had alcohol, and then there came heroin, all that kind of stuff, whatever. But now they have, it's pharmaceutical. That's what these teenagers are turning to, because it's easy, it's cheap, and they're under the table, and they're dying because of their fentanyl traced, you know? If we're talking about teenagers, I don't think any of these are going to work. If we're talking about older addicts that have already gone through 20 years and I'm so tired and that might work for them, because they're on their way to being, I'm done with it. Teenagers, they are going to go to get high because it's safe and the cops aren't going to find them. That's why they will go there. They're not going to get better. They're not going to for recovery. They're going to be safe. They don't want the cops to get us. We have a huge cop population here, and unfortunately they do go after ridiculous things at these kids on the teenage level. So therefore, you get 3 or 4 teenage friends, we're gonna go get high together, and then we can go do whatever we want, and we'll be safe, you know? So I don't know about the other two. I didn't feel like there was anything to offer them other than being safe high.
Okay, appreciate you saying what you're saying. I think Tyrell and then Kara. Yeah.
No, she kind of summed it up. I just had a question of, they were going to be doing it. I feel like there needs to be an emphasis on recovery while they're whatever facility it is, if it was tied in with Tukasa, I think is over there on 32nd Street, and they're the outpatient, the closest thing to a rehab that we have left anymore, since they closed the one down in Fort Bayard. I feel like it would need to be tied in somehow with them, you know, some sort of a 12-step, something to keep them going, because if they're going there, they're obviously taking a step towards wanting something other than what they have, I feel.
Okay.
It's not just it's not your, and this ties back to what I was saying before, it's not something that I'm gonna do, I'm not gonna go out of my way to do that unless it's kind of like a, well, maybe I'm ready to stop, I'm ready to look into something else. Like Amanda was saying, I'm tired. So if you've got something like that, you'd have to have some sort of a huge emphasis on recovery. Hey, here's a 12-step hotline to call, here's a outpatient, or there's the mental facility place, Tranquil Skies, I think I just saw over on 32nd Street. I think they used to be down on 90, but I think they maybe moved. You know, with a big push towards, you know, making that next step, not just come and use.
Okay, well, I think we're gonna almost end our discussion with Kara. You get the final word today.
Oh, great.
And then, you know, we'll be around, we'll be kind of cleaning up. You guys are welcome to chat or ask us questions if you like at the end too, okay? Go
Okay,
ahead.
and I think I'm going another step beyond what even Tyrone, is that your name?
Tyrell.
Tyrone, thank you. Even further out from that, because yes, the recovery piece is part of it, but one of my very best friends has been sober from alcohol and cocaine for 35 years. And she still has huge mental issues that she cannot get any relief from. There is no help for her out there. She's tried different medications. You know, I'm worried about her committing suicide all the time. And recently, this is a little bit of an aside, but recently she joined a group called Psychedelics in Recovery, which I had never heard of before. And so now she's doing things like, she's taking mushrooms.
Yes.
Like microdosing.
Yeah, more than microdosing.
Oh,
She's
really?
microdosing plus.
And
I'm like,
let's get our terms straight.
I never heard of any of this stuff
It's
until
new,
the last
yeah.
few months, you know, and I'm
Yeah.
like trying to be supportive of her. But anyways, what my point is here is it's not just about using the drugs, it's all the other, whatever the
Yeah.
mental
Yes.
imbalances are
Yes.
that we can't, and that's beyond this, and I understand
Yeah.
that. But in an ideal world, we would be going to that. What is actually happening in a person's brain, and how do we fix
Yeah.
that?
Yeah.
That's it.
Yeah.
Good point.
Could it be a place you could go into also and do some of your research?
Yes. So if something started, you know, the wise thing to do is to see if people would give permission right from the get-go that we could follow and track how it's doing. And in France, that's kind of how they went about this. They did a massive national study of people's impressions and opinions and concerns and kind of the political sides of it all. And the public support was probably less than 50% in that big national study. You know, one second, let me, just before I forget my thought. And then, so it kind of died. It's like, okay, this isn't going to pass. We're not going to put it through the legislature or the parliament. And then they came back, though, 2 or 3 years later and said, let's try again, but let's just pilot 2 or 3 in some key areas that we know we have a massive problem, and we'll do research the entire time. So we can share with the public what's actually happening as it goes, and then they might open to others. So yeah, we could go about that.
My quick question, have you actually had something like this with the people at Spin or, you know, the active people in the community of what do you feel would offer you the best opportunity to, you know, get sober? Because a lot of people don't want to go through a recovery, an inpatient recovery, or do something like that. But if you'd be working with Spin or you're working with Two Casas, have you talked to any of them
Not
about what would
yet.
best serve
Well,
you, and then try
yeah.
and make that mesh with whatever
Yeah.
the legislature is passing?
Good point. And so I'd say the Southwest Center for Health Initiative did a major, like last, I guess in 2019, a big study of the area, and they did have stakeholder focus groups. So they had the people that are already working and the EMTs even who go and deal with overdoses. You know, they had all these different stakeholders and people who provide treatment talk about what they thought the major needs were and kind of boiled that down into a plan. I look at that plan and it's missing this piece though. And the people in the north, I think, have gone a little farther. So Albuquerque and those areas are proposing more than just what we just want, like MAT. Like, could we even just get MAT down here? Could we even just get Narcan at the dang pharmacies? You know, that's kind of where we're at in southern New Mexico, it sounds like, from that first study. So this would be, we're kind of getting into a part 2, and I think a part 3 would be then stakeholders again. Okay, now if this passes, what do we want? What do you see? What do we need? And so I'm not to that step yet. I'm more just wondering, would the public, it kind of like in France, if the public is really against this idea at its core, then we shouldn't bother with the legislation. We should go a different route. So that's kind of where I'm at.
Can I ask a question about?
And I'm gonna go ahead and stop the recording though, so that we can like free people up a little bit
Right,
more.
and
Thank
then
you.
I